thank you very much, and good afternoon to all of you. I hope all of you are doing well, considering everything that has been happening over the last couple of weeks. Yawa to you, Reen, and CKON for making the time for me today to provide you with an update and the community with an update. I also want to mention that we've been testing some of the technology that we're using, so we are this broadcast is live as well on our MCA Facebook page, and it's being recorded and will be shared at a later date. So it's been 4 weeks now since we've declared the state of emergency in our community. I want to acknowledge that's been a very difficult time for all of us, and I want to thank all of you who have been doing your part to take precautions against the COVID-19 and taking it seriously and staying home. It's also been a difficult time for some of our families that have had to deal with the loss of a loved one. And it's in our nature to come together and show our love and support for a grieving family when a death occurs. What makes it hard during these very extraordinary times that we cannot physically console a grieving family, and it's so against our natural nature, and it feels wrong to not be able to do so. Instead, we must physically distance ourselves from each other and remain at home. I do want to observe a moment of silence in honor of those community members who have recently passed in recognition of their family for taking to understanding that it's been difficult to not be able to receive people. I want to let you know that the MCA receives regular updates from the local funeral homes, and at this time, only immediate family can attend funeral services, and the attendance is limited to 10 people. And this is a maximum of 10, including the funeral home workers. These limitations as well apply to the graveside service, and these limitations must be respected as they are in place to protect everyone's safety. The local funeral homes have advised us of these arrangements. And they've also advised us that if the community chooses to challenge these limitations that are in place for everyone's safety, they'll have no choice but to discontinue services being provided in Akwesasne. No provider wants to be ultimately responsible for a communal outbreak that could have prevented if everyone complied with these limitations. As a community, we don't want to see this happen either. Having said that, we need to be mindful on how this pandemic continues to evolve. These limitations are in place as of now and could change very quickly in the future. We'll continue to keep the community updated on information on funeral protocols as it becomes available. Representatives of the Mohawk Council, as well as the Syringes Mohawk tribe and the Mohawk Nation, currently participate on weekly video calls with local port directors of the US and Canada Customs. The purpose of these calls is for Akwesasne leadership to receive updates from the custom officials and for us to provide them with updates. It's an ideal way for all participants to share information during this pandemic. The number of cars crossing our border locally remains steady at the Cornwall-Messina border crossing, and this is one of the busiest crossings now in northern New York. I want to again remind everyone that with the ongoing pandemic, in our community, we should only be crossing the border for essential reasons. These restrictions are in place to limit your risk of exposure to the COVID-19 and ultimately the risk to your family who continues to be at home. The Mohawk Council has closed all public parks and playgrounds within the territory, and we place signs at these playground facilities to notify the community of this. This includes the tennis court on Cornwall Island. I want to be clear that these measures are for everyone's protection. It's our community members who are gathering together and hanging out at these places that places them at risk. The people in which you may be gathering with that don't live with you places you and everyone at risk. You have no way of knowing where your friends have been or who they have been with or where any of those people have been, and which places us all at a greater risk, which is why social distancing is extremely important and why practicing keeps everyone safe. It's very unfortunate that I have to report as well that some of these signs have already gone missing, have been removed and stolen. These signs, taking these signs does not prove anything. It's disrespectful to the people who are working day after day to slow this spread. We would appreciate everyone's cooperation and the entire community with respecting the closure of these parks and playgrounds. Recently, the Mohawk Council of Akwesasne passed the Akwesasne Emergency Curfew Law as a health and safety measure to fight the spread of the COVID-19 into our community. It serves and provides clear directive to our community members on emergency measures that are being taken. All residents of Akwesasne shall remain at their place of residence between the hours of 10 p.m. and 6 a.m., except for those who are engaged in essential services during these hours. Best efforts must be made to maintain a physical distance of 6 feet from any other individual when in public. Social gatherings are to be avoided, and residents who are returning to Akwesasne from a location of 50-mile radius from outside of the community of 50-mile radius must either self-isolate, and self-isolate is when you have symptoms, or self-quarantine, and that's self-quarantine and you monitor for your symptoms in case symptoms develop. And they must inform the MCA Department of Health of these circumstances, and that's for the entire community's protection. Compliance with these emergency measures is vital to the ongoing health and safety of our community members, especially our most vulnerable. This law was passed on this past Monday, and the full version can be viewed at the MCA website. We also know that the Syringes Mohawk tribe issued their own stay-at-home order on April 7th, 2020. Both of these measures are taken by respective community governments, complement each other. It's important for everyone to realize that there isn't any legitimate reason for anybody to be out past 10 p.m. except for essential reasons, especially in this time of a pandemic. Many of the local cases, whether it be in Akwesasne or the surrounding area, have been contracted by people who have traveled outside of the community. These measures will only be successful with your cooperation, and this is only temporary while we're in a state of an emergency. This past week, we have also followed up with community businesses, letting them know that they need to immediately take measures to protect their staff and the customers. Businesses should ensure that customers are social distancing and limit the number of customers in the store at any given time. I do want to thank those businesses who have taken safety precautions prior to us reaching out, and those businesses that have acted immediately after receiving our notice. Remember, we all must do our part to keep our communities safe. Our EOC continues to operate from 9 a.m. to 6 p.m. Monday to Friday and can be contacted by calling 613-575-5005 and 613-575-2331, as well by email eoc@akwesasne.ca. Again, it's important to please keep this information handy. These are the items that I wanted to share this afternoon with. I am open to take questions. Again, we are streaming this live on our Facebook page. We will not be able to answer those questions in today's broadcast. People will need to call in to CKON to ask those questions. So, Rena, I welcome that now.
All right, so again, that is Mohawk Council of Akwesasne Grand Chief Abram Benedict with the opening presentation for today's program, updating Akwesasne with regards to the MCA jurisdiction and COVID-19 pandemic response. So again, if you do have any questions for the Grand Chief, 518-358-3427, 613-575-2101. So I'll ask a couple of questions to get us going here. Grand Chief, with regards to positive cases, we've seen 3 that are in Franklin County on the southern portion of Akwesasne. Are there any positive cases for Akwesasne in the 3 districts?
As of right now, today, there is not. That does not mean that won't change. We are in the process of setting up a testing site, which will be rolled out likely in the next week. But as of right now, there are no positive cases under the three districts of the Mohawk Council.
And taking a look at contact tracing, should that need to occur, as an example, Public Health Department of Franklin County does theirs over in Franklin County. They follow up with the contact tracing. for anywhere that people might have gone, while they had symptoms, and looking at Akwesasne, if that indeed has to happen, if we do end up with a positive case on the northern portion of our territory, who would do that contact tracing, and is that something that is still being done? Would it be done by the Eastern Ontario Health Unit?
Yeah, so we have an agreement with the East Ontario Health Unit, who is the health unit responsible for the Cornwall, SDNG up to Prescott Russell area. When testing occurs, they receive the results, and if there is a positive test in our community, they immediately reach out to the MCA Community Health Department, and our MCA Health Department does the contact tracing. And the contact tracing means that they hold the interview with the person who has tested positive, go through who they may have interacted with for a period going backwards, and then the MCA health nurses reach out to those individuals and let them know that they may have been in contact with an individual who has now tested positive. So that is all done by our local community health nurses.
All right. Looking at another question from one of our listeners, and I think you just referenced that. When is the Mohawk Council of Akwesasne going to get testing kits for the community, which I think you just referenced?
Yeah, so we are in the process now of just waiting for the approvals. We have purchased a mobile trailer, like an RV type thing, which will be used as a station for the nurses who will be taking the samples to use to change in and store the stuff while the testing is happening. We anticipate that probably within the next week or so, and that will not be a drive-through. It will be a by appointment only at this point, but we will immediately share that information once all of the details have been finalized.
And we've seen the different responses from the states, different states, and then we have the different provinces in Canada. In the way that their testing is taking place, and who can get tested and things like that. Where will our mobile unit be set up?
So currently, right now, we're looking at the district of Akwesasne, and the sampling will go through the Eastern Ontario Health Unit. Okay.
And is there any, I guess, qualifications? It's probably not the right word, but whether you have symptoms or not, or things of that nature. I think that Quebec is doing some of the things, not doing the general public now kind of deal. So Ontario, I know that they've been trying to get more testing done, listening to Premier Ford on that. So is there going to be any sort of guidelines that, or, bullet points that people would need to reach in order to get tested?
Yeah, so currently they will be by appointment only to begin with. There is a lag time on the return of the tests. Health Canada has just approved some rapid testing, which will make this a much more quicker and easier. But for the beginning, it will not be the rapid testing. Through the appointment booking, the community health nurses will do an assessment and make that determination based on the calls whether or not you should be referred for testing. That will be in the beginning phases. As this becomes a bit more, as the rapid testing becomes available, as the processes are, more defined, it will become more broad. So for the beginning, it will be by appointment and on referral, and that I mean referral on that conversation from calling in to book an appointment.
All right. So next question from a listener: how will the curfew be enforced, and what are the repercussions if the curfew is being enforced by local law officials on the northern portion of the territory?
So the curfew in itself, and I know that social media really blew up on the positive and the negatives of the curfew when it was announced. Currently within the law itself, which you can find online at our website, akwesasne.ca, is that a person could receive a fine up to $1,000. And it would be the Akwesasne Mohawk Police Service who would be issuing citation tickets for that. It's extremely important to understand that through this through the whole COVID pandemic, enforcement doesn't, we have seen enforcement is one of the last measures. And what we want the community to know is that this pandemic is serious, that, the curfew law is for the safety of the community. It's not about issuing tickets and, raising revenue by far. It's about us ensuring that people know that this is a serious situation and that it's not something that I can tell you that council took lightly. We debated it for, well over a week on our calls. And with the tribe instituting the stay-at-home order, we wanted to ensure that we weren't seeing any what would you call like a spill off from them having the stay-at-home order, and then people who just wanted to be out driving around were just driving around into the 3 districts as a result of not being able to drive around freely under the jurisdiction of the tribe. Considering that businesses close at many close at 7, locally is 9. After 9 p.m. there's really not a whole lot of reason to be moving about the community, except for essential reasons. So, but back to the question, the Akwesasne Police will be responsible for that, but this really is about people understanding the severiness of this and doing their part.
Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, providing an update on the Mohawk Council of Akwesasne jurisdiction for the COVID-19 pandemic response and things that they've incorporated. Another question with regards to the curfew, will the city of Cornwall, do you think, implement a curfew as well? Have you been in touch with their mayor? How are things over there?
So we are on regular calls, whether myself or representatives of our council or the MCA, with the Eastern Ontario Health Unit, who all the measures that have been taken have been either issued by the province of Ontario or the Eastern Ontario Health Unit. So in our regular briefings with them, the province has not taken off the table a curfew for the entire province. So that if there were one to be instituted in the Cornwall area, it would come either through the entire province or through the Eastern Ontario Health Unit. So it's not taken off the table. They're considering a number of factors, but at this point they have not. But they have said that they have not taken it off the table.
And looking at the Cornwall numbers for the city of Cornwall, I know that they've just been making reference to SD&G and Prescott Russell and not really nailing down the exact number of positive cases in the city of Cornwall. So yesterday they announced that Dr. Paul Remoliotis would be sharing that information for the Eastern Ontario Health Unit today, specifically for the city of Cornwall. Now, since they've got that number that they'll be releasing today finally, will there be Akwesasne included in that with regards to the public updates that they do daily from Eastern Ontario Health Unit, should we have an Akwesasne resident on the northern portion test positive?
That I don't have a definite answer on, but I do believe so, yes. Because we do have an agreement, because the contact tracing is done by us, that once a confirmed case does happen in our community, then it would be identified on their website. I would just say, just on those numbers, I was on a call last night with Dr. Paul, the member of parliament, as well as the member of provincial parliament. And Dr. Paul did report, as of yesterday, there are 62 cases in the Eastern Ontario Health Unit region. As you mentioned, Reen, they will be breaking that down. So, either now or later today, they will have that published. But I can say that there are 10 cases in the city of Cornwall that will be going up.
All right, so there are 10 positive cases in the city of Cornwall?
Yes.
Okay. And another question from a listener, they would like to know, is it okay to have small fire pit fires that are controlled?
No, at this time it is not. Last week when we spoke, I let the community know that in collaboration with the Mohawk tribe, the Akwesasne of Hogansburg Volunteer Akwesasne Fire Department and the Mohawk Council, we've issued a fire ban. And that's simply because we cannot risk having a fire getting out of hand. Our volunteer firemen show up, have to interact with persons that they may or may not have COVID-19, and then it places our first responders all at risk for something that clearly could have been avoided by not having a fire.
All right. Again, phone lines are open at 518-358-3427, 613-575-2101. And if you have a question for MCA Grand Chief Abram Benedict, you can phone that in now. Taking a look at like we said, the provincial picture and also the across Canada kind of deal, looking at the funding that's being provided for Indigenous bands throughout Canada, is that something that that we're receiving from the federal government? Are any of those dollars earmarked for Akwesasne? And have we received them, or are we going to receive them? And if so, how much?
Yeah, so the federal government had announced some money specifically for Indigenous communities. We are recipient of some of that monies. It's to the tune of about $1 million. Right now, that money is being allocated to support the food distribution program that we have operating. We do have some other costs that are related that we will be putting to that. There have been some additional monies that the federal government has announced on the health front. So that money has been has been injected directly into the health system, which, you know, as a result is purchasing PPE, which will be made available to our health services, as well. Some of that other money is available through proposal or quick application. We will be making applications available to that. We do know that, you know, this is, all of the projections now indicate that this will continue, you know, likely into the fall before we can really start resuming some sort of normal activities. So the costs related will continue to be incurred. So that monies that was provided to us, the $1 million, you know, will be used to support initiatives going forward.
All right, so looking at the Akwesasne Mohawk Police Service, one listener wants to know if the Akwesasne Mohawk Police Service can sit at the point of entries to keep non-residents out of the 3 districts. Is that something that's been discussed, or?
Well, not in too depth. I know that a number of other communities, you know, in Ontario and Quebec have put up borders around their communities. It's quite difficult because of our geographicalness of our community. You know, is it the best use of the police resources to be stopping individuals coming into our community? It's something that we would have to consider. You know, individuals coming into specifically our 3 districts, you know, there is, you know, unfortunately not a lot of commerce in those districts. So I'm not sure why people would be coming into those areas. Now, the police services are observing, you know, people that may be coming in for reasons that are not good or illegal. So they, you know, they have been monitoring and taking actions where necessary, but using them to put up, you know, checkpoints is not something that we're in the position of right now. It's really about, you know, we all need to do our part in protecting our community and, you know, staying home and not inviting people to come here and making sure that we all stay safe. This is not about the, you know, one party keeping us safe. This is a community effort that we all must do our part in.
And taking a look at that funding again, I had made reference to the federal government. Are there any dollars from the provinces, from Ontario or from Quebec?
As of right now, I'm not aware of any. There could be. The province of Ontario is really, you know, making investments into the healthcare system, and our partner there would be with the long-term care facilities. So they are making investments there. the provinces have been really looking to the federal government to take lead on, injections into communities right now.
We have another question. What council has extra food? I think they're making reference to either the tribe or MCA, and they want to, let's see here, what council going to do. Okay, so what is MCA going to do to be able to provide food for community members? I know you made reference to this Friday again. Can we elaborate on that a little bit? And also we'll offer the EOC number again for people that can't wait until Friday if the emergency, food needs to be had today. Is that correct?
Yes, they can call the EOC if they're in a position where they're not able to. We will have the food distribution pickup on this Friday at the respective schools, as well going into May. This program will continue for the next few weeks. Understanding that this was initialized for a couple reasons. One was that there was a lot of panic buying happening in the towns and cities around us, Cornwall and Messina, which were leaving, we're potentially putting some of our community members in the position where they're not able to get any because it's not available. So that was one of the reasons. The other one was accessibility. And some of, are people able to get there through their regular means before? As well, we wanted to ensure that the elders were able to get, were taken care of as well, because they are the highest risk as of right now, although we all are at risk, but the elders are the most vulnerable at this time, and a lot of them, including us, including just the general public, are scared to go out. But I think that measures have been taken at the grocery stores around us to make sure that people aren't congregating, that disinfecting is happening regularly. But we will see the food distribution, not our food distribution, but the way we shop at grocery stores will continue to evolve in the next several weeks, if not months. I think that we'll be at the point where, there will be just curbside pickups for all of the food that you need. And we'll look at ways how we'll continue to make, food accessibility to our community available for our members.
And taking a look at this Friday, Akwesasne Mohawk School, Ganadaga School, and there's a new site for Akwesasne for the food distribution through MCA. It's going to be at Yohahio, Akwesasne Education and Training Institute, so that people are aware of that. That is going to be the Akwesasne location. Grand Chief, I'm looking at the emergency food packages distribution dates. I see Friday, April 17th, and then I see Friday, May 1st. Is there a reason for the lapse there?
Yeah, so we've spread it out a bit. That the calls for home deliveries have gone up significantly. We're really trying to vet through the ones who don't have cars, who are elderly, to be able to have them delivered to their home, and then the breakup, of the pickup time or dates have been scattered a bit so that we can allocate some of those resources on those other days to the home deliveries. It's important to note, we will continue to make, arrangements for those who are not able to. But those who are able to and are encouraged to be able to continue to access the grocery stores around us. These measures are to be able to help those who don't have mobility or are at higher risk, so we really need to take care of those elders and the ones that are higher risk first, and then the other ones are a subsidy to help the community at this point. So that's why, that's been broken up a bit.
We have another question. Do you have someone that can advocate for people without the INAC cards at CBSA? And this caller says that they are being brought in and threatened with deportation. Have you heard anything on that?
I haven't received any information on that. This is our third week with the border calls with the tribe, the Mohawk Nation, and ourselves with the U.S. and Canada border situation. As this started, we really, reiterated to community members that they should be using their status card. I know there's some reservations around that, but it was just so that we're not in the position where people are having issues or, having to go in and interact with the officers. So if there are those situations, these are really, there are certain cases that an individual may be in that position. If they reach out to our office or the tribe or the Mohawk Nation, we have contacts at the customs, and we can, assist in working through those situations.
Are there any phone numbers that you can offer? Would it be EOC, and then they can direct it to one of the three councils, or how do we reach out to those three councils for that?
Yeah, I would suggest giving either the Syringes Mohawk Tribe's EOC a call or our EOC a call.
Okay. All right, just so that everybody has the phone numbers, we mentioned them off the top. We always want to make sure, please put these in your phone or write them down and put a magnet on the fridge, whatever the case may be. For the Emergency Operations Center, Syringes Mohawk Tribe EOC, 518-320-0019, 518-320-0019. Also, MCA EOC, 613-575-5005, 613-575-2331. So those are the phone numbers for the EOC. We are looking at another question here. MCA, let's see here. Can MCA work harder to get rapid testing like they have in the cities?
Yeah, so the rapid testing, like I said earlier in the program, has just been approved within the last week or so from Health Canada. The rapid testing may have been available in the States sooner, but we have to use equipment that's approved by Health Canada to ensure that it is accurate and safe for everybody. So we are in the process of setting up a assessment center where people will be assessed and tested, and then once the rapid testing becomes available, we will be using that equipment. I just want to say on the testing, that it is, by getting tested and getting a negative, doesn't make us immune to it. So it's important that we social distance, that we stay at home, that we take all precautions to protect ourselves, and when we do have to go outside of the community to get groceries or to access essential services, we all have to do our part and be cautious about that. And I don't want a sense of well, I got tested, I'm negative, and I'm good to go, because you can essentially walk away from a testing center, be negative, and interact with somebody very quickly and be positive at that point. So, but back to the question, once the testing becomes available, the rapid testing, that's what we will begin to use.
All right, now looking at people that might come over from the southern portion of Akwesasne, are they able to do that to come to the Akwesasne testing site, or would they have to still go to somewhere in Franklin County?
I believe right now that once the testing assessment center is established, it will be through priority listing, that first responders, medical health professionals will be provided the opportunity. Right now, if there is a concern, or you have been told to by either the East Ontario Health Unit or one of the counties, the Franklin County or St. Lawrence County, you will have to follow up with them. So with respect to residents who are not on the jurisdiction of the MC, we'll roll that information out once we have finalized all of the process.
All right, we have another question. Again, if anybody's got any questions for MCA Grand Chief Abram Benedict and everything that's under the jurisdiction of MCA, for the COVID-19 response. We have a listener who says, thank you very much, Yamagoa, for putting in the curfew. And they also would like to ask, their husband is a resident at Yakisota. Can the Mohawk Council of Akwesasne set up funding so that they can, for example, video chat as a way of visiting their husband at Yakisota?
Yeah, I know that the staff there, well, I want to give a shout out to all of our healthcare staff and first responders and essential workers are working really hard, to keep our community safe. But I know that they have been taking pictures, making it's something that we can examine to look at, making the video call equipment available to them at this time. So I will take that back to our health folks and see what we can do. But currently right now they're doing the best that they can with what they got, but we'll look to see if the new equipment can be made available.
Excellent. Now, I know that it was announced yesterday that Tyendinaga Mohawk Territory restricting their community to local traffic only, so that the Mohawks of the Bay of Quinte respectfully requesting that Akwesasne refrain from traveling to their nation for the hunting and fishing purposes which they normally do, and they asked as a preventive measure to protect their community from COVID-19 exposure. So you had received that notice from Tyendinaga, Grand Chief?
Yes, last week I had received a call from the Chief of Tyendinaga, who I speak to many of the Haudenosaunee community chiefs regularly. He did let me know verbally that he was requesting that community members please refrain from coming to their territory for hunting and fishing. They did follow up with a letter to us this week, just in which we've shared on our social media pages, letting the hunters and trappers know that at this time their council and community is requesting that you refrain from visiting their community, simply because everybody is very concerned about individuals coming into their communities, including ours, who may have the virus and infecting our community. So we ask that people in our community please respect the wishes of the Tyendinaga community.
And another question, kind of along the same lines, what about the people who travel out of the 50-mile range for the hunting, gathering, and medicine picking? How is this going to affect them if they do go past that 50 miles?
Mm-hmm. Well, I mean, people who are traveling outside of the 50 miles is making that choice as an individual. We would hope that they, are not doing that, but I do understand that some individuals may need to be able to do that for, to be able to get medicines that may be not in our area, that may be further than the 50 miles. We ask that, if this trip is made, that, you do quarantine or self-isolate when you get back, and that is for the protection of yourself and your community and the family, your family and our community. Obviously, we don't have any way of knowing who does, but really it's about, limiting the risk of the household in which you live in and limiting the risk to the community at large. If you're able to get those medicines closer, or be able to, is likely, the best option right now. We ask that you please don't make those choices to travel far. Again, all of the cases in the community so far, as well as the Cornwall area, have been people who have traveled outside of the 50 kilometers and have interacted, not even interacted. In a lot of in Ottawa, what they call communal transfer is happening. That means that they don't know where it came from. You just cross by somebody, touch a surface that's not cleaned, and then you pick it up. So it's, we're really asking people to not travel outside of that distance. It's for your safety and for our safety.
And really another question from a listener, what is considered essential travel?
So, I mean, as I mentioned earlier, there's not a whole lot of things open. In fact, there's nothing really open other than the hospital or, maybe a gas station outside of the community after 10 p.m. There is in the law, which is available on our Facebook page as well as our website, does give a definition of exactly what essential means. And essentially, it's traveling to get to health services. It's traveling because you have to have, there's something that you have to receive at night, whether it be, have baby formula or diapers that can't wait till the morning, things like that are as essential reason why. I know that there's a lot of stickler around this law. It's not because we want to tell people what they can and cannot do. This law is for the protection of our people and our community as a whole. It's not to restrict, it's not to upset. This is a measure that we have not taken lightly, but had received a lot of feedback from the community, especially elders saying, why are they putting not a curfew, but a stay-at-home order in the tribal jurisdiction? Why is the Mohawk Council not doing it? And that is why it was instituted. And we really want people to be, after that time, only going out for essential reasons. And if you want the exact definition, it's available on our website through the law. If we don't have access to the internet, we can make that available in other means.
And question with regards to the reopening of the schools. Does the Akwesasne Mohawk Board of Education follow Ontario? Are we able to make our own decision because we have our own school board? How will that work when the time finally comes to reopen the schools? Can we open before or after the provinces make their dates known?
So just on the call we had yesterday with East Ontario Health Unit with Dr. Paul, he did, essentially said that this school year is not going to happen. So up until June, the province has extended their orders pretty close to the end of the school year. We do follow, we use the Ontario legislation for education as the guiding principles for our curriculum. Because we are a federal school, we have the ability to develop our own rules and curriculum around education. But at this point, the school year, is not going physically opening the schools. It will not happen before June. September, it is still at this point is unknown. Now, whether or not we would do it before or after the provinces, likely not before, because again, the issue is that there's, classrooms are anywhere from 15 to 25 children in there. There's no way of knowing what child has it, and one child in one classroom with it potentially could affect all of them. They all go home, and it's a very bad situation. So we will continue to look to the outside for guidance on how the systems are dealing with this, but as well, we're continuing to move forward with virtual learning. With this, the Akwesasne Mohawk Board of Education now has virtual learning occurring as we speak. The teachers are interacting online with their children who are doing assignments. This potentially could be something that will happen in the fall. It's really hard to know at this point. This is really an ever evolving situation where it changes, essentially day to day, but nothing is off the table at this point with respect to opening or how the education system will evolve, and when the schools will physically reopen is still unknown.
All right, another question from a listener, MCA. The listener says MCA has sent home some employees due to compromised immune systems. What about spouses of employees who have compromised immune systems? Should they be sent home with pay?
So as of right now, the MCA has not laid off any employees. Many employees are at home on stand-down status. Some employees are working from home to support the community. Some, as you mentioned, some employees are at home because they have compromised immune systems. We're working with our employees on a case-to-case basis where an individual may be working still, meaning they're at the workplace working, but their husband or wife at home may have a compromised immune system. If they come forward and speak to their manager, it is something that we likely can accommodate for them.
And another question with regards to MCA staff. Some MCA staff have been ordered to stand down, as you referenced. This listener says, but they're still being paid. When will they be forced on to collect unemployment insurance?
So as of right now, as just I previously mentioned, no employees have been laid off of the MCA. There has been no definite date set. If there will be, if any layoffs will occur, there's no date set as a point of now. We are looking at what options or what mechanisms may be available for those staff members to either perform part of their duties from home or to do other things. And those other things may include training using virtual learning for something related to their job. We're examining all of those options right now, but no employees have been laid off. No date has been set. The stand down status, they will continue to receive their salaries, and understanding that when those decisions have to be made, we will communicate that well in advance to the community. Understanding though, from the leadership perspective, if employees are laid off, it just creates the problem of them not having an income and all of the problems associated with that as well.
All right, so we're going to be wrapping up. I'd like to wrap up at 1 o'clock, so let's close those phone lines now. Looking at Grand Chief Abram Benedict from the Mohawk Council of Akwesasne, sitting down with us today. We're talking to him via telephone. They do have the Facebook Live going on the MCA Facebook page as well, and talking to him about MCA's jurisdiction in regards to COVID-19 updates and responses. Grand Chief, I know you mentioned that you guys meet with your fellow council about 3 times a week. Is anyone working on a plan to get back to normal, whether that happens in August or, whether that happens in May or whether that happens in December? Are we working on a plan to slowly start to get back to normal when it's safe to do so? Are we working on that plan now?
So unfortunately, there's no target date set yet. And that all is based on how society, and including in our community, how we act and protect ourselves. If individuals are starting to feel that, that the virus is not here, that they're not going to get it, that they're wearing gloves, they're going out and about, just for any reason at all, and they contact it, bring it home, it create, and then off it goes. There's no so understanding that this continues to be a real risk to all of us, so we should not take our guard down. All indications through the provinces, through the both governments of Canada and the United States, there has been no set date of when we will get back to normal. So when will the Mohawk Council get back to normal? I can't tell you that. We don't know. So what plans are we taking? Through administration is looking at what the next phase of within interaction of the employees will be, what services can be provided remotely, how can we continue to ensure that the community needs are being met. Those plannings, medium to long term, is happening now. In collaboration with our department heads and our administration is working on that. I don't have a set date yet. But what I do want to share too, though, in chatting with our health folks, we have a number of healthcare providers who are available through telephone or through telemedicine using video conferencing. If there are people that need prescriptions renewed, have other illnesses that don't fall in line with the symptoms of COVID-19, had an appointment locally canceled with one of our healthcare providers, give our clinic a call and have a conversation with them as well. A lot of services are now being provided over the phone that they can have prescriptions refilled, chat about current statuses of their health, non-COVID related. I want to let people know that give us a call at the clinic, and they'll look after that for you. But on the back to the planning, those conversations and plans are being developed as we speak.
Okay. And Mohawk Council of Akwesasne, are they working with Bell Canada to increase internet access in SNI and syringes?
Yeah, so this is, over the last couple of weeks, we have seen lots of anomalies. So now everybody is at home accessing the internet, which, some would argue it was slow before, and now it's really slow. This is not only happening here in Akwesasne, this is happening everywhere. So we are, we're continuing to look at what options may be available. Prior to the COVID virus coming into Canada, just not too long ago, we were in the process of planning for a fiber expansion into our community. We had received some government funding. So I know that, this planning will pick back up. That's not a short-term fix. I can tell you that the providers are aware, Bell Canada specifically, they're doing the best that they can, but it really is an infrastructure issue, meaning that the lines need to be replaced. So it's not an easy, immediate fix to be able to increase the speed at people's homes, unfortunately, right now.
One last question that I've got in front of me from a listener, and then we'll ask you for your closing comments, Grand Chief. For the post-secondary students who just finished the online courses from college, is there anything in place to help them financially?
Yeah, so the school year will be wrapping up. The post-secondary supports will continue to the end of the school year. We're looking at what options may be available. I mean, obviously, summer jobs are going to be a challenge for us in many areas, considering everything that's going on and the ability not to be physically doing certain things. Lots of scenarios keep rising up. I can assure you that the students are on their minds to see, for us to respond to their needs as well. The only thing I can say right now is stay tuned. We'll continue to look at what options may be available.
All right, so closing comments, Grand Chief, as we wrap up today.
Well, I want to thank you, and I want to thank the CKON staff again for making this available to us. I do want to say to the community, thank you to all of you who are doing your part. This is a community effort. I know this is not easy. This is a very difficult time for all of us. This is something that, we never thought we would ever have to deal with in our lifetime. I know there's lots of resources online available for us. I will say that locally there's this Facebook page that What's for Dinner that's up there, and lots of people posting to that. And I must say that there's lots of great community cooks in our community, and people are keeping busy doing that, and so that's great to see. I want to tell the community that, we need to remain positive. We're resilient people. We must support one another and continue to have faith that things will get better. This is a day-by-day situation that continues to evolve. We all have to do our part, and I want to thank all of you for doing your part. And I do want a big shout out to our healthcare workers who are working very hard to keep our community safe, keep our dudas safe in our facilities, and our essential workers who are here, who are working day in and day out to keep us safe. This is a community effort, and Akwesasne, we will get through this together.
MCA Grand Chief Abram Benedict. Take care, be safe, and we'll talk to you next time.